I'd like to continue with our afternoon session now. So, well, the second session of the forum is evidence-based approach to ageism, global evidence and sectoral realities in healthcare and employment. And it is a great privilege for me to introduce the moderator for this session, Professor Sung-jae Choi, Chairperson of the Board of Directors of ASEM Global Aging Center. He is also a Professor Emeritus at Seoul National University. Professor Choi's distinguished career in social policy and aging research makes him ideally suited to guide our evidence-based discussions. So please join me in giving him a warm round of applause. Thank you.
All right, this morning we have a keynote session, and first session was the general understanding of the ageism and cultural variation, and based on these keynote speeches and the first sessions and presentation and discussions. And now at this second session, we are going to look into what is happening because of ageism, particularly focused on healthcare and employment and sectors of the society. This is a very important area of our life, employment, work, and healthcare. As health is really related to your livelihood and also your life itself. So these two areas is very important. But as you may know, these two areas is very important, but where the ageism is typically and manifested in all over the society, as we may learn this morning. And now, we are going to look into what's happening in these two sectors of employment, healthcare, and of the world. And we invited three speakers from Korea and from WHO, from Malaysia, and also we have two discussants from Czech, and the other person from where is she? Indonesia? Oh, WHO, you're right, yeah, okay. I'm getting old, a little bit, not good memory. Okay, we have first presentation is here from WHO, Alina officer. Are you ready? Okay, let me give you some instruction. Yes, you may know before, but we have only given 90 minutes for this session. And as you may know that each of the speakers is allocated 15 minutes presentation time, and also about 10 minutes for the discussion. And I want you to watch your time and how many hours, how many minutes are left for my presentation. And this is very important to keep time and not to make it delayed a little bit. Oh, okay. So we have first speaker here online, and I wanted to introduce briefly Elena officer. her biography is printed here. Your material you got here. So I will read a part of this. And she, Elena now is head of the Department of Demographic Change and Healthy Aging and Health Aging Unit, and coordinate implementation and monitoring and evaluation of the UN Decade of Overseas and oversees the organizations working on age-friendly environment, including the Global Network on Age-Friendly Cities and Communities, and the global campaign to combat ageism. She also coordinates the recently established Commissions on Social Connections. And the other, her career is, you can look at more detailed one at your conference material. Ms. Elena, Elena, officer, could you please start your presentation?
With pleasure, Professor Choi. Can you see my presentation? Is it clear enough?
Yep.
Yeah? So I am really sorry that I can't be with you in person at the 5th ASEAN Forum on the Rights of Older Person, but also especially that I didn't get to enjoy that delicious lunch that I'm sure you just all had. But I am very thrilled to join this session and speak to the topic of measuring what matters using the WHO Ageism Scale, which is a really important tool to drive inclusion and policy change. So I wanted to give us a little bit of background. So in 2016, 194 countries or member states of WHO called on us to develop, in collaboration with others, a global campaign to combat ageism. And that campaign had a vision, a world for all ages, and its mission was really to try and change how we think, how we feel, and how we act towards age and aging. Now, the campaign focused on three main areas: strengthening the data and evidence, building a global coalition, and really trying to raise awareness around ageism. And the work that I'm going to talk about today, particularly on the ageism scale, is relevant to all of these three areas. But it goes beyond that because it's relevant to a number of other really key initiatives. For example, the new Human Rights Council resolution from April that called on governments to come together as a working group to develop a legally binding instrument to both promote and protect the rights of older persons. Understanding about ageism is crucial to that work. MIPA, the Madrid International Plan of Action on Aging. Ageism is relevant to all those three priority directions when we're getting to talk about policy. Professor Choi has already mentioned the UN Decade of Healthy Aging. One of the priorities is tackling ageism, but changing how we think and how we feel and how we act towards age and aging is relevant to the other three as well, plus obviously to the Sustainable Development Goals. So many of you will remember that one of the first key outputs from the global campaign was the UN Global Report on Ageism, which was developed by WHO, UNDESA, OHCHR, and UNFPA. And it had three key recommendations. One, that we needed to implement and scale up 3 evidence-based strategies that prevent and tackle ageism. We know that that's policies, intergenerational contact, and education. But we also need to improve data and research so that we can gain a better understanding of ageism, both against older persons, but also younger persons, particularly with a focus on low and middle income countries where data is really sparse. And lastly, that we needed to change the narrative to create much more positive and more accurate narratives around age, aging, and older people. So the ageism scale was really developed in response to these 3 recommendations. So now let's get to the topic at hand. Let's drill down into why measures actually matter. We know that what we measure actually gets attention. And if we don't have an accurate measurement around ageism, how can we know what is the scale of ageism, who is most affected, in which countries, in which regions, which people, in which context, for example, healthcare or employment? We won't be able to know what are the drivers of ageism or even the consequences of ageism. And we won't be able to assess whether the interventions that we invest in are effective in preventing and responding to ageism. And so the ageism, WHO ageism scale is a new way to measure ageism. Before we really started to develop the scale, we needed to think and define what it was that we needed. And this included being able to capture ageism in all of its dimensions. So this includes how we think, how we feel in terms of prejudice, and how we act in terms of discrimination, whether it be towards ourselves or towards others based on age. So we needed to then understand also, is it self-directed? Are we directing it towards ourselves? Are we directing it towards others? Or is it something that is occurring within our institutions? Our world is very diverse, so we needed a scale which was valid, so it measured what it said it was, it did that in consistent ways, so it was reliable, but also that it could be used across the world. And because ageism affects people of all ages, it needed to be applicable to different age groups. In addition to that, it needed to capture our own experiences of ageism, really, and ageism towards others. So as a result, we developed two scales and more to come. So the first one is what we call the experiences scale. Yeah, so how you, your own experiences of ageism. There are both 5 and 15 item versions. It measures self-directed, interpersonal and institutional ageism, covering stereotypes, prejudice and discrimination. It's been validated in all UN languages. And just to give you a sense of it, and I'll pop the link also in the chat for those who can access it. For example, at my age, my life has plenty of purpose. Yeah, that's sort of self-directed. Yeah, or others feel frustrated with me due to my age. Interpersonal ageism. People my age are portrayed positively in the media. An example of institutional. We also, another scale, developed one of ageism towards older people specifically. So this is also currently a 15-item scale, and we will be able to bring it down to a 5-item version in the future. It's been validated in English and Spanish, and others are also being worked on. Now, what this one covers is interpersonal ageism, yeah, that happens between people. It covers stereotypes, prejudice and discrimination, but it's answered from the perspective of somebody who is being ageist or a perpetrator, yeah, in terms of ageism. We do a mix of both positively and negatively worded items to be able to capture positive and negative forms of interpersonal ageism. And in this scale, examples include older adults have a lot to contribute to society. So that's a positive stereotype. I feel frustrated with older adults, an example of a negative prejudice. And I avoid spending time with older adults, discrimination. We're also developing an ageism towards younger age group scale. I wanted to give you just a sense of where and how it's already been used. And so you'll see on the slide a number of examples. The first 5 of those come from HelpAge International's work, you know, covering age-friendly citizen communities in Colombia, Ukrainian refugees in Moldova, people who have been affected by floods in Libya, the experience of lifelong learning in Lebanon, and Zimbabwe and Somalia are also looking at climate resilience. In addition, the Hello Consortium is looking at ageism and healthy aging across 9 countries, Singapore, Indonesia, different countries in Europe, the US, UAE, and Thailand. But I just wanted to drill down into a little bit more detail on the example from Colombia And Marcella Busmanti from HelpAge kindly provided these slides, so huge thanks to Marcella. So in Colombia, 13% of the 52 million population are 60 and older. Now, this study was not representative, but it included 398 older persons who participated in scale implementation. 76 of those were women. Because they were looking at also reinforcing intergenerational contact, they had 28 students who participated as surveyors. Now, if you look at the results from Colombia, interestingly, most older people say that they were satisfied with how age-friendly their cities and communities are. And interestingly, those who felt more satisfied with their communities also report the lowest levels of ageism. But where ageism does exist, whether it be self-directed or interpersonal, it showed up in very tangible ways within this study. Less civic engagement, fewer work and social opportunities, and a stronger sense of not being respected or included. We can also see from the results that Marcella shared that there are clear disparities. Older people with lower education, lower income, or disabilities experienced higher rates of ageism. And in Colombia, the strongest form of ageism that older people reported, in fact, came from their institutions through the policies and practices that made them feel excluded. And we can see clear consequences in this small group for health. For example, higher experiences of ageism were linked to poorer physical and mental health, greater feelings of loneliness, and lower overall sense of well-being. But I think this data also suggests that there's a path forward. So where people had more intergenerational contact, and we know that that's one of the most effective interventions, ageism is lower and they feel less lonely. Communities that foster these connections tend to be seen as much more age-friendly. But also that many participants in this study pointed to the role of media. So television and advertising was seen to reinforce those negative stereotypes, portraying older people as dependent or incapable, which fuels ageism even further. Well, so what have we learned? So far, the scale has proven highly versatile. It's already been translated in all 6 official UN languages and many more, so with very few issues. It shows strong psychometric properties, so that means it's reliable both in terms of consistency and test-retest, and it demonstrates really good validity across the different measures. Really importantly, it's well accepted by older participants, making it quite practical to use in very diverse settings. And I think beyond that, it generates new insights into ageism, something that no other tool has been able to do at this level. And that's why it remains today the only scale that fully meets the necessary criteria. So if you're asking, what can you do? And if you want to leverage these new measures and the ones that are going to come forward, you can use the WHO ageism scale in anything from small scale, like Marcella used, to national, cross-national surveys. You can use it as an outcome in intervention evaluations to be able to test whether the intervention made any difference, both pre and post. You can use it to learn about the prevalence of ageism within the context in which you live or work. You can get a sense of what are the patterns. So what are, like Marcella and what we found in the global report in terms of intersectionality, for example, with disability, with gender or race. What are the determinants or the drivers of ageism within your particular context? How is it playing out? So what are the consequences for individuals, but for society at large? And which are those interventions, policy or programmatic, that are actually effective? So the WHO ageism scale is incredibly flexible, can be applied across very different countries and contexts, from low and middle income to high income countries. It also allows us to explore, as I said, how ageism intersects with other factors like race, like sex, like socioeconomic status. And to even look, and we're going to talk about this, I think, spatial drivers of ageism, you know, segregated spaces, workplace, what happens within our healthcare, our digital spaces that may be driving ageism. It can also be used in very specific political, social, or even historical context. Yeah, we could have used it in the context of COVID and understood how COVID impacted on ageism. It can also be used, as I've said, in specific contexts such as workplaces to really give us much better insights into how ageism shows up in our daily lives. And I just want to reiterate, you know, language is so important. So the fact that it's available already in 11 languages with more translations on the way, it will be incredibly accessible to be able to use across the world. So if you want to know how you can use it, it's open access to the scale, to the manual. You don't need any permission to use it. You don't need any permission to translate it. But we do have somebody available if you're looking to translate it and you want support in that process. But we do need your collaboration to support countries to have better information around ageism as it affects both older men and women. I just want to leave you on a note, and you heard from Marlene this morning, but I think, you know, just to say that as part of the campaign, which is what I started with, there are many other materials that I just want to offer up that are available for you to use as well. Yeah, whether you want to run an event on ageism, or you want guide, you know, in terms of how to have conversations around ageism, or you want to avoid ageism in your communication, or you just need some social media assets, some films, some infographics. These are available to you for use whenever you need them. But beyond that, we also have additional evidence and data, whether it be on how artificial intelligence within healthcare is playing out in terms of ageism. We also have connecting generations. So how do you bring generations together in a meaningful way that can address ageism? But also, if you haven't read it, there's a progress report on the decade for the first 3 years. I mentioned that the work on ageism supports the work on the decade, and you'll see there that we are making progress. So 83% of countries that reported for the decade said that they had national legislation on discrimination by age in 2023, which was up from 60% in 2020. So that's some progress. Just in closing, what you can do, please support further validations in your different countries, different settings, in different languages. Please do use the ageism scale, spread the word. If you want technical support in translating or using it, here are your contact details. Contact Asia, who's the technical lead on developing the scale, and she's fantastic, or contact us at Hello, A World for All Ages. There are other ways to get involved. So in addition to the scale, do join and leverage the global campaign, read and use the report. It's very relevant, and all of the tools that have been made available with it. If you're going to invest in interventions, please invest in the ones that work. So policy, intergenerational contact, and education. And please do work with us to improve data and research to gain a better understanding of ageism and how to reduce it. And on that note, I want to say thank you.
Thank you very much for your excellent presentation. And Mrs. Alana, Ms. Alana Officer, she particularly emphasized the measuring the ageism is crucial for understanding its reality. And she also introduced the ageism scale developed by WHO. Furthermore, she presented a case where the new measurement scale was applied in Colombia, and suggested that the WHO ageism scale should be actively utilized. Okay, next we are going to have a second speaker here, and we have here she's on the platform there. second presenter is Dr. Tanggu Aidul Hamad. Yeah, Aizan Aidul Abdul Hamad. Yeah, yeah, is that right? Yeah, is that right? Yes.
Tengku Aizan Hamid, that's all.
She is a pioneer in the field of gerontology in Malaysia, and she brings over 30 years of experience in aging and social policy. In 2002, she founded a multidisciplinary research center on aging, and which evolved into the Malaysian Research Institute on Aging 10 years ago. Congratulations. Yes. She also served as its founding director until 2020, and leading significant advancement in research, education, and policy development. And though the others' careers is printed in your conference material, would you please, Dr. Ahmad? Yeah.
Thank you, Dr. Chow. I would like to thank the organizing committee for inviting me to share my thoughts on ageism in Southeast Asia. Okay, and next. Actually, it'll be, my content will be on the global ageism, health and social employment, evidence from Southeast Asia, and I want to discuss about the structural barriers to access and some practices intervention in the Southeast Asian countries. Okay. Yes. Okay, what is ageism? Actually, I don't want to go through all this because I think Elena has already alluded to the different dimensions of age-friendliness, of ageism. And globally, it's 1 in 2 people holds ageist attitude, yeah? And in the health and employment sector is systemic because, and actually ageism harms mental and physical health and reduces life expectancy and increases social isolation, social exclusion. And in the context of Southeast Asia, we are really in the midst of a transition in terms of our demography, but also our social institutions lags behind in terms of the speed of change in relation to the demographic shift. So in the sense that when you talk about the rapidly changing older person, the institution is slow, so there is a big gap in terms of labor force participation and things like that, and also there is inadequate healthcare and social and legal protection in the sense. And if you, I'm sharing this labor force participation, which we developed for ASEAN-SAC, where we see that the older person's involvement in the employment sector reduces a lot, but if you look at the ages, a lot of these people that are in labor force are actually in there because of they need to be in the labor force, but they are not in the formal sector. So that means there is little social protection for them to live and to benefit from the labor force participation. Because usually when you talk about the ASEAN context, majority or maybe 2/3 of our population are in the rural areas and are involved in the agriculture sector where we don't have much protection. Okay, and in terms of ageism in healthcare, there are actually similarities with Southeast Asia and the global evidence, but because if you look at the geriatric and gerontology curriculum, we are not really mainstream. And also in the global evidence, there are also same issue. And in the Southeast Asian region, we have very limited long-term care services, especially in rural and remote areas. And basically, the family carers are overburdened due to the policy gaps and all. And the older person themselves also are sidelined with digital health transformation, because the present older person are not really highly educated and not exposed to digitalization. So there is this gap in terms of access to digital health, where a lot of governments in our region are trying to transform. Okay? And there is also the internalization of ageism among the older person themselves, leading to delayed care-seeking behavior and acceptance of decline as normal. And because of that, there is resignation to suboptimal care. And assumption of frailty and non-productive influence care decision. And of course, in terms of what WHO reported was ageism is more pervasive than sexism or racism in some health system. Okay? And in terms of ageism in employment, many countries in the Southeast Asian country has quote-unquote mandatory retirement ages without flexibility. You have to retire when you reach certain chronological age. Yeah? And there is also the age-based discrimination in hiring and training, because there are many of the countries, when they advertise for employment, they put age below age 40 or something like that when you want to get re-employed and things like that. But there's also the limited access to upscaling and reskilling, and the stereotypes of less productive and technology-evasive older workers. So that itself already affected the discrimination of the older workers in employment. And if you talk about in the care sector, a lot of the informal care workers, especially women, lack pension and labor protection. So in the sense that even though the region in Southeast Asia are aging, but there are actually three distinct kind of aging process in the Southeast Asian country. We have we have Thailand and Singapore, which is already aged, and we have 4 other countries that are transitioning to aging, and we have the other 4 countries that are going towards aging. So there are a lot of differences or gaps in the ASEAN region itself in terms of how do we address aging issues, and in terms of ageism in healthcare sector and also employment. So there's a lot of work for all of us in the region to look at how we can address this issue. Next is the structural barriers in policy and system. Many of our policies are age-blind policies that fail to segregate age, and we hear this morning also, and we also have lack of legal protections against age discrimination, because I think none of us, I guess, none of the countries, I guess, already have a legal protection or a legal regulation in terms of age discrimination. But I think that the more advanced aged state in the region is Singapore, where they have re-employment policy and things like that for older person. And there's also the weak interministerial coordination on aging, because they see aging as a new issue, and there are other sectors of the population which are critical for the government. So this is where we need to really be advocates for older person, because majority of the countries in the Southeast Asia will be aging, yeah. And also there is underinvestment in the age-inclusive health and employment programs, and basically the cultural norms actually reinforce dependency and exclusion, because many of us feel aged before we are aged chronologically, because a lot of us also felt that you don't have to go anywhere, we are old already and things like that. And also children do not allow us, the older person, to be active and things like that. So because they felt that if they allow the older parents to be active, meaning they, quote unquote, they are not doing the filial duty towards the older person. So that's the dilemma of you want to be active on your own, but there are so cultural barriers that are hindering us from doing that. And I'm sharing here selected practices that are being done in some countries, where in Brunei, during the COVID time, they had these apps to monitor COVID and things like that, and they have extended the application to include e-health and things like that. So even though the system is not just for older person, but it's now extensively used by the population to make appointment, to monitor their health and things like that. So there is some intervention that is positive in terms of including the older person also in terms of the system. And in Indonesia, there is the digital health records that roll out for electronic medical records and things like that. Even though it's not extensive, but there is a positive move towards that. And then in Malaysia, we have Future Jobs, and we have what we call the program of Future Jobs age 50 plus. And then we have home help program in the community to help the older person be integrated back into society, and also to have access to healthcare and so on. And in Philippines, they have the healthcare interprofessional geriatric training. So this is the comprehensive geriatric training for professionals in the Philippines, and it's just a pilot program to train the people, human resource in geriatric medicine. And in Thailand, this is quite an interesting program where they have the National Long-Term Care Scheme and Community Volunteer Carers. Because in Thailand, they have community healthcare workers that goes into the community to look at the health status of the older person. So, and they report that status into the community clinics and things like that. So the older person gets attention to that. And in Singapore, this is the most advanced state in terms of inclusiveness for senior citizens. And they have skills future for seniors. They also have flexible retirement pathways and re-employment policy. I think the only country that has re-employment policy for older person is Singapore in the ASEAN region. And in Vietnam, we have the community self-help clubs for older person, which is a very comprehensive income generating programs, and they also link with the local clinics, district clinics, to help older person monitor their health status. So these are some examples of intervention that is already on the ground to address the ageist attitude that is now counter that will reduce ageist attitude in the region. And I'm sharing here with, the EU project, which is called Age Inclusive Workforce Management Practices in worldwide companies, where they were doing a literature review on how do you encourage age inclusive workforce management, and they developed these interrelated domains, which we have 6 domains here: organizational culture and leadership, work design and economics, and health management, knowledge management, intergenerational coexistence, and the retirement pathways. And they look at it as at 3 levels, where you can have the company level, country or regional level, and at international level. So let me go through some briefly in terms of that, where we look at, when you talk about organizational culture and leadership, you look at how the leadership in the organization has positive attitude towards how do they want to create inclusive workforce, because we know now we have multi-age or multi-cohort workforce. So how do you then integrate this workforce to make it into a culture that you accept all levels of workforce? Because even now we have young generation workforce and older generation workforce, and human resource finds difficulty in handling this group. So they are saying that you must have the leadership. When you talk about that, it is at the top top-down level, and you must also look at how the workplace can have a work design economics so that it will help reduce the health effects of the older workers, but also increase productivity. And related to that is the health management of the workforce, either the young cohort or the older cohorts. And within the workforce, you have knowledge management, because in knowledge management, you talk about succession planning and things like that, and guiding the organization so that there is a continuation in the workforce in the organization. And the next one would be because of the knowledge management in terms of understanding the young workforce and the older workforce, you have intergenerational coexistence, and because of that, you try to work together in terms of co-producing the element of work integration and productivity within the young and the old workforce. And of course, there is this retirement pathway where, in the end, you need to look at how do we plan retirement pathway, what selection you want to do and things like that. You have, and these are important issues. And if you look at the international level, they will be the guiding principle, because EU already comes out with a lot of guidelines for the intergenerational workforce. We also have at the country level some policies that will integrate this. And at the company level, this is the most, this is the lowest level where the HR people has a role to play in trying to be age inclusive in the workforce. So my recommendation is this: we should reframe aging, and this morning we talked about it also, and Elena also talked about that, in public discourse as a valuable life stage, embedded anti-ageism principle into healthcare and employment policies, invest in geriatric care capacity and inclusive workforce strategies, promote intergenerational collaboration to combat age stereotype. Aging is not a problem to solve, but a growth opportunity to harness. And conclusion, ageism is not just a matter of attitude, it is a public health and human rights issue, urgent need to shift from age-blind to age-responsive system, and we need to build societies that value, include, and protect older person, to foster intergenerational solidarity and structural change. And the takeaway message is, ageism is a systematic issue that requires structural change, not just attitudinal shift. Let's reshape Southeast Asia's healthcare and employment system to be age-inclusive, right-based, and future-ready. And this is an advertisement where I come from, getting to know PPA. It's a private pension administration in Malaysia, where we are the voluntary sector, voluntary scheme for all Malaysians to invest for their retirement savings scheme. Thank you.
Thank you. Your excellent and concise presentation. She particularly stressed the ageism is not merely a matter of individual perception of attitude, but structurally and systematically embedded in society. And she also introduced several practice intervention and programs implemented in Southeastern Asian countries to address ageism. And she argued that eliminating ageism requires a transformation from toward a age integration, right-based, and future-oriented society. Yes, it's our long mission all over the world, and particularly for this Korean and the Southeastern area. Okay. Now we have the third, Dr. Lee Young-soo. He's a collaboration professor at Institute of Aging, Korean University. human resource management for the elderly. He holds a PhD in business administration from Korea University and Master of Industrial and Labor Relations from Cornell University in US. And he particularly dedicated his long life for the government services and Department of Minister of Employment and Labor, and also other public organizations. He also served as president of Korea Polytech, one college. Yeah. Dr. Lee, please.
예, 안녕하십니까. 반갑습니다.
Good afternoon. It is my pleasure to meet with you all. My name is Su-Young Lee, Collaboration Professor. So today I would like to talk to you about employment of older workers and age discrimination in Korea. It's my honor to be here. I worked myself for the Ministry of Employment and Labor for nearly 30 years, and also I was the Director General of aging-related department. And without addressing ageism, I reiterated that our economic development will become something in vain. So on this topic, I've been lecturing students, I've been writing books. And let's put our heads together so that we can come up with measures to address ageism and also to improve quality of lives of all citizens throughout reasonable ways. So this is a table of contents. I will first touch upon demographic changes in Korea, employment status of older workers, age discrimination, policy recommendations. So I think we need to really pay attention to demographic changes. I need to try this one to control my slides. So demographic changes. Korea is facing an unprecedented pace of low birth rate population aging as of December 2024, and also already there was a sharp increase in life expectancy. There's a sharp decline in total fertility rate. So there was 1 million newborns back in the 1970s, which is down by 75% to 250,000 in 2022, meaning that there's a huge decrease in the working age population, an increase in elderly and total dependency ratio, meaning that one person needs to take care of at least 3 older persons. So there's increase in elderly and total dependency ratios, which leads to expanding social security, intensifying intergenerational conflict, weakening of economic growth potential, or refer to as population owners. And so by 2050, our population will be remained at around 47 million. From 2020 to 2050, there will be an increase of older population by 11 million, while the working age population will decline by 13 million, and median age of our population will be 58. So elderly population ratio will become 30% in 2036 and 40% 2050. So decreasing working population needs to take care of increasing older population. Businesses also have to think about how they are going to maintain their economic competitiveness. So I asked ChatGPT to draw an illustration of this situation. So I think ChatGPT is also worried about Korea's aging population. And in Korea, there's a Framework Act on the Employment Policy Act on provision of age discrimination in employment and elderly employment promotion. So it says that employers shall not discriminate against any of their workers or any person on the grounds of age. For example, there are 5 different sectors: recruitment, employment, education and training, salary, provision of money, placement, transfer, and also retirement and dismissal. So we refer older persons as those who are aged over 60 or semi-older persons for those who are aged over 55. So the trend in employment rate of older persons, so economic participation rate of older persons is increasing from 65% to 71% in 2023 from 2013, but which it is still lower when it is compared to Japan by 9%. So there's a lot of room for us to grow in terms of economic participation rate of older persons. Now let me touch upon employment characteristics and future work preferences of older workers. When we look at industry distribution by sector or by industry, they tend to move to low-quality jobs. And also, as they are not fully supplied by pension or additional income, there are lots of issues, and more than 40% will be just satisfied with only $1,400 per month, which is not high enough. And now let me turn to you about age discrimination against the older workers. So that is a very specific result of action taken against the older persons, which is related to intergenerational discrimination. So there's uneasiness and conflict between older generation and the young generation. Ageism can make current situation worse, and also it may intensify, and the distrust, hostility of the younger generation towards the older generation will increase. So one thing is related to welfare benefits, and the other is related to jobs. So especially welfare benefits. When welfare benefits are allocated to elderly more, then the younger generation will probably bear the burden of welfare costs. If the total labor demand in an economy is fixed, then the elderly and the young have to compete for jobs. However, in Korea, more than 80% of the workers are working for SMEs, and also SMEs are suffering from lack of workers. So this possibility is unlikely to happen. However, we talk about extension of employment, and of course, for example, good jobs by a larger size. The companies and also public institutions, young and older generations are likely to compete with each other for quality jobs. And also, let me talk to you about labor productivity. In aging theory, as age increases, it says that productivity goes down, according to that theory. So as age increases, physical strength, the cognitive ability, and literacy skills decline. And when you turn to your 60, there's one research out in Korea that labor productivity declines. And there's a theory called the human capital theory. For example, older workers possess abundant job-related knowledge and also skills and experience, which can be interpreted to increase or improve the labor productivity. When we use especially robots, then the labor productivity of older persons can also be increased. Now, let me turn to wage discrimination in the labor market. So the retirement age is 60 years old in Korea, but the actual age is 53 when you have to leave your main job. So many old workers, whenever they are re-employed, they are likely to experience poor quality jobs with a lower wage. So in the labor market, labor productivity of old workers are lower than that of young persons. So this is average monthly wage by wage gap. So the people reach their peak at around 4,383. The unit is 1,001, around the 40 to 44. But by year reach, like 60 to 63, the wage is decreased by 33%. So as you get older, then your labor productivity goes down. So you have to also pay attention to the size of the company or gender and also educational background, because there are gaps which is arising from that. So, for example, the workers of the small and medium companies, their wage is only 62% of the workers working for large-sized companies, and also there's wage gap between men and women, and also young and also older generation. So we have to come up with the policy measures to address this. And also,
고령자의
Now, let me talk about the vocational training for middle-aged and older people. And you can see that the participation itself goes down as the age group increases. So at the company level, there is a lower interest in upskilling, and they consider this cost. And not only Korea, but countries around the world are going through Industry 4.0. That is why people should be trained again for the second job, because they don't get to stick to the first job. That is why we need to increase vocational training for people over 50 especially. And let me talk about the retirement status of the older persons in Korea. We have the retirement, which is 60. However, you can see that 53 years old or 49 years old people leave their job. And when we look at the reason, there is only 9% of people who retire due to reaching retirement age. There are more people who are recommended to resign, and even more people are leaving their job because of a business downturn and the suspension of operations. So we see the percentage of older persons working as full-time employees until the retirement age is only 14.5%. So let me talk about policy recommendations. We need a fair hiring practice for sure. As I said previously, especially in Korea, when we hire workers, we cannot discriminate them just because of age. And we have a punishment enshrined in the law. And when we talk about fair hiring, we should evaluate the candidates based on their performance and technological level, not based on age. And we cannot include ageist condition in the job advertisement as well. And we have to reform the wage system based on job value and performance, especially in Korea. Wage is determined by the supply and demand of labor, and it is protected at the lower and by the minimum wage system. However, it is more heavily dependent on seniority-based pay systems now. So it is not relevant with job value and individual performance. And if we excessively provide high wages relative to their job value, it will lead to early retirement. And we need a wage system which reflects individual performance now. So when we have this kind of a wage system, we can abolish the current retirement scheme because they will be paid by their job value, which doesn't require retirement scheme. And we are discussing the re-employment system, which could give birth to a new wage structure. And when they are re-employed, the income level could decrease. However, the government could provide a wage subsidy. And one example is Japan's continuous employment benefit, which is a government subsidy for re-employed older persons. And this is a unique system in Korea, which is called the wage peak system. So 58 is the peak age, and 10% of income will be reduced every year, afterward. This is because of the seniority-based pay system in Korea. And there is a controversy over this system. And it is based on the negotiation between the management and the labor union. And the Supreme Court determined that this is not against the Constitution. But if the income is reduced by 50% just because of age, it will be a violation. But there is one consideration. So when the wage goes down, we have to reduce the labor intensity and work hours accordingly. And the wage peak system, and to my perspective, I designed the subsidy system and supportive system for the wage peak system. So we need to develop the mid to long-term approach, which could complement the wage peak system. And let me talk about the training for the middle-aged and older persons. We need this to increase the productivity, especially for incumbent workers. They should upskill themselves in their current position. In the workplace, they can be trained, and they can be trained by the government program as well. And when they are trained, it could lead to higher productivity and higher income, and it could lead to the longer or extended employment periods as well. However, if they leave their main job, or if they would like to retire, in that case, we need pre-retirement and transition support programs, and we need the companies as well as government support for this. And on the individual level, workers can utilize the tools so that they can learn about artificial intelligence and big data, which are big things these days, so that they can improve their productivity. And we have the government subsidy for this as well. And let me talk about the intergenerational division of labor and collaboration. Younger generation is strong with fluid intelligence, and older workers have strengths in crystallized intelligence. They have their own unique advantages, and it could be reflected in their roles and responsibilities. And we can divide labor between different generations, and we can develop a proper job for older persons, and we can also target collaboration in terms of skill transfer and mentoring. Next, we are discussing the extension of employment, and we can take a direction which enables a win-win outcome between generations, and it should be linked to the government activities. So if we extend the employment period, it will enhance the job stability, but it requires a greater wage flexibility or productivity. Otherwise, extending employment period is not sustainable, and we have to ensure fair distribution and strengthen both corporate and national competitiveness through this program. In particular, when we consider employment extension, we have to support intergenerational coexistence. As I said, in the overall labor market, the employment of older workers does not necessarily reduce youth employment. However, in high-quality jobs, which is coveted by younger generations, just like large corporations and public institutions, there is a high likelihood of competition between older and younger workers. That is why labor and management within a company should be able to choose between extending the retirement age or adopting a re-employment system. As such, the implementation of policies to address age discrimination is expected to promote intergenerational cooperation and improve the overall quality of life for all citizens. Thank you very much.
Dr. Lee, and he particularly focused on labor policy and the sector of the labor, what ageism is manifested. And particularly, he recommended 4 concrete and policy to improve the age discrimination and to combat ageism. Thank you very much. Okay, next we will have 2 discussions from online, right? That 2 persons are not here. So we are here from through online, right? Okay. First discussant is Miss Lodora TURALDE-BABARAN. Yes, she is Director of Human Development, Asian Socio-Cultural Community Department, and ASEAN Secretariat. TURALDE-BABARAN, would you please start your discussion?
Hello, good afternoon, everyone. I hope you can see and hear me well.
Yeah.
Yes.
Yeah.
All right. Okay, so apologies that I was not able to join the event in person, but we thank you very much for the invitation to be part of this event. So once again, a very warm greeting to everyone joining this 5th ASEM Forum on the Human Rights of Older Persons. We're very delighted to share with you some updates coming from the ASEAN in terms of what we are doing to promote an evidence-based approach to ageism in the ASEAN region. To begin, kindly show the second slide, please. So empowering older persons as active stakeholders for social change and development is imperative to ASEAN community building. As such, ASEAN is strongly committed to advancing the rights of older persons through promoting active aging and empowerment of older persons in the region and advocating for their rights and welfare. ASEAN's commitments are evident in these key regional instruments and frameworks, which complement each other for impactful outcomes and results. So let me just highlight some of them. I will not be going through them in detail, but these include frameworks going as far back as 2010. We had the Brunei Darussalam Declaration on Strengthening Family Institutions, which takes concerted efforts to promote quality of life and well-being of the elderly, as well as reduce social risks faced by the elderly through 10-point actions on social support system development, education programs to enhance ability of families to take care of the elderly, to strengthening intersectoral collaborations and partnerships. We also had the ASEAN Human Rights Declaration adopted in 2012, which identified the elderly as a population group and whose rights are inalienable, integral, and indivisible part of the human rights and fundamental freedoms. Then in 2013, we had the ASEAN Declaration on Strengthening Social Protection, and it was followed up by a regional framework and action plan in 2015, which contained the principles, strategies, and mechanisms contributing to the vision of uplifting the quality of life of ASEAN peoples, including the elderly, as one of the target population groups. In 2015, we had the most important framework we have so far on the elderly, which is the Kuala Lumpur Declaration on Aging, Empowering Older Persons in ASEAN, and which was followed in 2021 with the Regional Plan of Action. And to support the commitment of ASEAN, the ASEAN Plus 3, composed of 10 ASEAN member states, China, Japan, and Korea, adopted the ASEAN Plus 3 Statement on Active Aging. This was adopted in 2016 to promote greater inclusion for active aging. And then in 2021, we also had the ASEAN Comprehensive Care Economy Framework, which amplifies ASEAN's shared agenda on addressing challenges on paid and unpaid care work as key to building inclusive societies in the region. Next slide, please. So ASEAN's efforts in empowering older persons in all aspects of life is embedded in the Kuala Lumpur Declaration on Aging, the one that I mentioned earlier. So this declaration enunciates ASEAN's high-level commitment in promoting the rights of older persons across the region, with focused attention on the 10 key areas for cooperation and collaboration. These 10 commitments cover priorities in the areas providing support to families and caregivers, promoting intergenerational solidarity, ending all forms of elderly abuse, adopting inclusive policies, building data on aging, improving stakeholders' engagement, promoting age-friendly communities, and strengthening participation of older persons and their organizations and partnerships. The ASEAN Ministerial Meeting on Social Welfare and Development and the Senior Officials Meeting on Social Welfare and Development serve as the ASEAN's regional mechanism to ensure the full enjoyment of rights of older persons in this region. And these mechanisms are complemented by the ASEAN Plus 3 cooperation in social welfare. and development. Next slide, please. Under the ASEAN +3 Statement on Active Aging, ASEAN has committed to promoting a holistic approach in raising the quality of life and well-being of older persons and in addressing the multidimensional nature of aging through a greater inclusion for active aging, particularly in elderly care and health, economic empowerment, and supportive environment for inclusive society for all. Next slide, please. Let me also share that ASEAN shared agenda on fostering inclusive growth, social stability, and resilience of communities is also enunciated through a whole-of-government approach in strengthening the care economy in the region. So, following the ASEAN Comprehensive Framework on Care Economy adopted in 2021, last year, the leaders adopted the ASEAN Declaration on Strengthening the Care Economy and Fostering Resilience towards the post-2025. And this is a testament to ASEAN's unwavering commitment to advancing care economy in the region, which at the outset will benefit the most vulnerable groups in our societies, especially the older persons. Among others, the ASEAN Comprehensive Framework on Care Economy aims to promoting healthy aging and leverage opportunities in aging societies in all 10 ASEAN member states. Through the leadership of the ASEAN Committee on Women, the Senior Officials Meeting on Social Welfare and Development looks forward to the finalization of the guidance note on strengthening the care economy. Next slide, please. Let me also share very briefly, in the ASEAN health sector, there are initiatives on healthy and active aging guided by the ASEAN Post-2015 Health Development Agenda. It envisions a healthy, caring, and sustainable ASEAN community. Under the ASEAN Health Cluster 1 on promoting healthy lifestyle, ASEAN is committed to ensuring healthy lifestyle, ensuring healthy lives and promoting the well-being for all at all ages. And in order to promote healthy lifestyles, ASEAN gives priority attention to the promotion of health and active aging. Next slide. I'm also pleased to share that ASEAN has a Center for Active Aging and Innovation, or ACAI. I believe the Executive Director is joining us in this event as well. It plays a significant role in supporting ASEAN's preparation for aging societies through providing opportunities for multi-sectoral platform to facilitate integration of aging and innovation strategies. Its purpose is to generate knowledge and innovation which supports active aging policies and their implementation, strengthening the capacity and facilitates collaboration among ASEAN member states, international entities, and other partners in achieving active aging in ASEAN. Next slide, please. ASEAN also leverages regional cooperation to strengthen the generation of data and evidence and innovation on aging. Initiatives have been undertaken to support active aging and their implementation, strengthen capacity, and facilitate collaboration among ASEAN member states, international entities, and other partners in achieving active aging in ASEAN. Just to highlight a few, these include the ASEAN-wide Research Network on Aging, or ARNA, the ASEAN Gender Outlook that uses gender lens in looking at ASEAN's achievements across the Sustainable Development Goals, the ASEAN, the Research on Old Age and Poverty, and the ASEAN Publication on Aging through the ASEAN Magazine. Moving forward, ASEAN is prioritizing the development of the ASEAN Active Aging Index to be spearheaded by the ASEAN Center for Active Aging and Innovation. At this point, ladies and gentlemen, I wish to highlight the ASEAN's high political commitment to preparing for aging societies that is fully articulated in the Kuala Lumpur Declaration on ASEAN 2045, our shared future. So this is the new roadmap for ASEAN community building adopted by the ASEAN leaders during the 46th Summit in May this year. This declaration adopted the Community Vision 2045 and the strategic plans across the community pillars that embody the strategic goals and measures to building an inclusive and age-friendly societies. To this end, ASEAN leverages regional cooperation to promote efficient effective, age-friendly, and supportive responses, policies, and programs on aging populations. Aging societies also present far-reaching implications to economies across member states. And as such, the ASEAN Economic Community advances inclusive, innovative, and competitive economic business environment, ensuring that older persons and other vulnerable groups are actively participating in regional economic integration with more preparedness to facing future trends, including the demographic shifts. And in building a seamlessly integrated ASEAN community, ASEAN fully supports the adoption of existing and emerging technologies to enhance competitiveness and productivity. As a caring community, ASEAN's commitment in the socio-cultural community encompasses goals and aspirations on improving the quality of life of peoples, especially for the vulnerable groups. These commitments are expressed in the ASEC strategic plan, which includes a promotion of adoptive social protection and strengthening family resilience through the work of social workers and the wider social service workforce. The strategic plan also outlined key measures in addressing systemic and institutional barriers, strengthening the care economy and care infrastructure, especially at the community, in recognition of the increased time spent on unpaid care and domestic work, which are predominantly performed by women and girls. ASEAN is also fully cognizant of the need to mainstream population aging issues into policies and development plans and programs at all levels, which may include promotion of healthy, active, and successful aging, care economy, lifelong learning and digital literacy, flexible employment and retirement policies, and sustainable and accessible infrastructure. A key strategic measure under the socio-cultural pillar is to strengthen disaggregated regional and national data, including by age, ensuring it is coherent and that data collection and its use is coordinated and integrated. Down to my last substantive slide, let me just also share that in July this year, Malaysia convened the ASEAN plus Republic of Korea Conference on Care and Support for Older Persons in Kuala Lumpur, Malaysia. Part of the recommendations of the said conference is harnessing technology, data, and research to address age and gender-specific digital divide, improve care quality, service accessibility, and system efficiency through supporting innovation and knowledge-driven transformation across sectors. The conference highlighted the reactivation of the ASEAN-wide research network on aging with a vision of strengthening evidence on aging to better inform ASEAN's policies and programs on aging population. Moving ahead, ASEAN embarks on reviewing the final implementation of the sectoral work plans across sectors, including social welfare, health, labor, and others, in developing the next regional priorities for 2026 to 2030, ensuring that the rights and welfare of older persons remain integral in ASEAN's regional cooperation and contribute to the achievement of the ASEAN Community Vision 2045. Ladies and gentlemen, I hope this information were useful reference as we work towards synergizing our actions in building societies that embrace aging population with compassionate care and respect for their well-being. Thank you very much for listening and looking forward to fruitful discussions ahead.
Thank you for Ms. Rodola TURALDE-BABARAN and your good discussion. And from the Asian perspective, and she said that Asian promoted great inclusion for active aging in national policy making and action plans, including active employment policies and health care services. And lastly, the second discussion is Ms. Bidobichoba from Czech University. Okay. She is the Dr. Bidobichoba is professor of sociology. She got a PhD in sociology and social gerontology. Would you please you got 10 minutes discussion time, please.
Thank you so much, and a very good morning from me, and very good afternoon to you. I'm really blessed to be here with you today. I hope you can see my slides, if that's visible for you. And what I would like to also add to information that the ASEM representing Maastricht University, but today I want to share with you data which we produce at the Research Institute of Labor and Social Affairs in Czech Republic, and use these empirical tools to go a little bit deeper into more even philosophical question, why ageism is still with us, why is it on a rise, and why is it so difficult to go away? And the main point I want to address is that there is no ageism without age. This is the salience of the age as per se that makes this issue so difficult, because in today's societies, we use age, the chronological age, as we are assigned that by our birth. We use it in our societies and structures of those in these institutions that we produce. And we already heard over the presentations today how embedded they are. We use age as a stratifier into, give rights and choices to us, to ourselves. And we can see this in different types of segregation of age groups, being that in education, at the workplace, and all other different institutions that we have in our societies. We also use age in the interpersonal interactions as we embedded them in age norms. And this could be both formal and informal. In Czech law, for example, we have about 40 different age norms, which gives you rights or obligations to do something or forbid you to do something until, for example, you are 18. And there is a lot of those throughout, not only the legal system, but also how we behave towards each other. You are too old to do this. You are too young to have this opinion. And these age norms are really flowing in between us as we go through the society. And also age is very important, or is perceived as being very important in our self-concept and to how we understand each other, how we think about ourselves, how we think about our own bodies. And we also seen that and addressed that already in previous presentations. So as a result, we as a sociologists talk about age as an instrument of identity, how we construct ourselves. We use it as an organizational element of social relations, and we use it as the characteristics of social roles. We are mothers, and it's typical to be, of such and such age. We as older workers are people of such and such age. So this, social roles are also characterized by chronological age. And being that so important and so pronounced in the societies, is then very easy to use it as a base of discrimination. And this is how we actually end up with ageism. So there is no ageism without age. And I think this is the first point I want to really highlight. As a result, we can see that we encounter in our societies this age segregation of age, different groups that have very limited possibilities to talk to each other, to interact with each other and learn about each other. The data I'm showing are based on survey that was done by the end of the year 2024 in Czech Republic in adult population 18 plus. And the sample is is almost 3,000 people of a population of 10 million people. So it's a very sound, solid survey. And it shows that about half of the population feels that, for example, young and older people are two completely different worlds, and they kind of are aliens to each other. And there's the other half, and that's the good part, but it's slightly lower, that says that, no, we are basically the same. We just have a different age. So we can see there's this kind of almost conflicting approaches how to address these groups. Are we kind of want to support more eradication of these, two people as being alien to each other? Do we want to work towards more like understanding that these two groups have a lot of in common? But it also means, do we want to be age blind, or do we want to celebrate the age differences? And this is a unresolved question we still have when we talk about ageism. What is the opposite? and it was also mentioned in previous presentation, ageism is pretty much gendered. It's pretty much based also in socioeconomic status of people, holders, perpetrators, all of them. These are just sample of different statements that we offer to our respondents. And you can see that there are clearly very strong gendered attitudes, for example, about how women of certain age should dress. You know, there are age norms in dressing. There are differences in how we perceive aging of men and aging of women. And the norms are much harsher in a way for women. We are never of the right age, right? We are too young to be involved, then we are in the age of being mothers and therefore probably not fit for the labor market and so on and so forth. But there are also, as I was already mentioning, more subtle expectations related to age, as for example, to sexual activities of in later life, or even, and that was shocking for me, this expectation that no one over 60 should take up a political office. And this is a long-standing attitude we see in our data that is highly against any democratic approaches. Like in the democracy, everybody should have the same right to be represented and to represent. But here we see about half of the adult population saying that age should be the barrier. And this already kind of well known and discussed that, you know, we feel that people of older age are kind of burdened for the state budget, there are financial risk and so on and so forth. And these are very persistent and very high that are showing these differences in ageism based also on age, socioeconomic status, and other intersection characteristics. And yet we see the debates are rising, but we have to repeat that age is the most often experienced base of discrimination or different treatment, more in general. These data are showing results for survey, the same one we've done in 2007, 2012, and the last one, 2024. And we can see that age is continuously the top selection, so to speak, and it's on a rise. But we could have seen how much has been achieved already in the field of gender discrimination or discrimination based on gender. And how little in the comparison we are talking about the problem of age, and that needs to change. This graph, I'm sorry, it's a little bit complicated, but let me guide you through it. It shows the same result I was showing you before, now in different age groups and for being discriminated on the basis of age and being discriminated on basis of gender, and that for 2007 and then later in 2024. So these light lines are showing the data from 2007, and you can see two different shapes. First, the discrimination perceived or experienced discrimination based on gender is on decline as people or the respondents are getting older. While in age, we have this kind of swoosh shape. When we see it, it's very high for younger people between 18 to 34, then it's a little bit lower, and then it rises up from 50 onwards, up to very high numbers. And which is interesting dynamic. Sometimes I make the joke that as you are older female, you are not deserve even being discriminated for, which is a very harsh joke, but the data show that. But again, the message here in this that we have to think about it as a life course issue. Ageism is nothing that happens only to older people, but it happened to us throughout the life course, and we need to address it as such. And what is striking for me, and I don't know, still I don't understand the result, is the extreme rise of age discrimination, especially in the young cohorts, which is skyrocketing 47% in the last year in the youngest age groups of the respondents. So there are still issues that we need to tackle because these are the roots of what's happening later on in the life. The good message, in a way, is that people ask them.
You got only 1 minute, please.
Yeah. This is my last slide. That the discrimination is recognized. People see that it's rising, and they feel that this is something that is in the society and that needs to be developed. But there's still these 14% who say, I don't know what's going on, I don't follow this. So there's still a need for more addressing the issue. And my last slide, which is, again, just to show you, ageism is part of, or we can consider that as being part of violence that we have on the basis of age in our societies. There are different types, but this graph is showing us that, again, violence is nothing that happens just to older people. It happens also much early in the life. And these issues, being that age-based violence, even just showing as an ageism, needs to be addressed throughout the life course. So I wish that, and I'm very happy that actually this conference is also adding to this, that we have these discussions, that we kind of show that ageism is a complex issue and needs to be addressed on all these different levels. I started with, it's just not just an institution, it's also interpersonal matters, and it's also how we treat and think about ourselves. And with that, I wish happy aging to all of us, and happy aging with rights, because we do deserve that. Thank you very much for the opportunity to share these thoughts with all of you.
Yeah,
Thank you.
Thank you for you, Dr. Bidobichoba. We have almost time, but I'm very sorry that I have controlled the time, and because I want to have about 10-minute discussion time from the question and answer and from the floor, but we didn't have time to do that, and almost time. But if you have one question or comment and from the floor, and you have any question and comment on the presentation and discussions on this second session? No one? Yeah. I thank you for your cooperation. Yeah, to save the time. Okay, thank you very much for your attention for this second session. But everybody and the speakers and discussants was very serious about their presentation, but it took a little bit more time than I expected. Thank you for your attention.
Thank you, Dr. Choi, and thank you everyone for another great session.